Now, once we know that our information is secure, we can tackle another rising concern, and that is healthcare cost. We all know this, but to put it in perspective, in 2000, healthcare spending was just 1.4, I say just, but it was $1.4 trillion. And by 2022, that had tripled to $4.5 trillion. And so despite all of the legislation and regulation, we have yet to bend the cost growth curve. And our healthcare costs are unsustainable for the government and for employers. And so despite all the challenges that we face in healthcare, we also have to become more efficient and more affordable. Today, a family of 4 in the private market will pay almost $1,500 a month for healthcare coverage, and that doesn't even include the employer's portion. So it's not surprising that 1 in 4 said that they had skipped or postponed needed care in the past 12 months due to concerns about cost. And another looming danger, adding to the mix, the cost of the Medicare program, which is going to grow dramatically over the next 10 years as the baby boomers consume more healthcare services. Now, there's a lot of talk in Washington, a lot of talk, over how to sustain Medicare because the program's designers never anticipated that beneficiaries would live this long, nor the plethora of the million-dollar drugs that help make that possible. And the Medicare Trust Fund could run out of funding if action isn't taken. So another complicating factor in the rising cost of healthcare are the misaligned incentives between payers and providers. And let's consider that in the context of Medicare for a moment. As Washington figures out how to sustain the program, Medicare Advantage offers some promise. It provides beneficiaries with more choice and more benefits with the advantages that privately managed care can offer. And now about 50% of seniors are choosing MA plans. But the discussions around Medicare Advantage have centered on its financial underpinnings, whether providers are receiving adequate payments from the plans, whether CMS is paying plans appropriately. I always felt like I did a good job, but, and discussion around appropriate coding and prior authorization. As Medicare Advantage continues to grow, how can we make it work better? And the reality is the friction between payers and providers, whether it's Medicare Advantage, Medicaid managed care, and commercial providers, all of that is contributing to the 25% that we spend on administrative costs in the healthcare system. So that means 25% of all of our healthcare spending is just on administrative costs. So I mentioned the friction, and much of that centers around claims payment. And so here, AI is playing a huge role in reducing manual work and expediting revenue cycle management. And Oracle is proud to have completed our work with Oracle Health Revelade Patient Accounting. And that's now live at Baycare and Vandalia Health. This solution allows healthcare operations to be more efficient and easier to reduce administrative burdens and the costs associated with them. And later this year, we're going to be offering our new payment product, allowing healthcare providers to take advantage of Oracle's credit card payment solutions. Just another example of Oracle's modernizing healthcare. And you're going to hear more about our work on providers and payers in the future. But another answer to rising costs is creating new treatments that can help cure and prevent disease. So for example, we've all heard about the new class of weight loss drugs on the market, and they cost as much as $1,000 per month per patient with no clear treatment endpoint that doesn't result in rebound weight gain. So patients could be taking these drugs for the rest of their lives. We don't know. Now the CBO says that the cost of providing these drugs is more expensive than the value it extracts by lowering the risk of other healthcare problems like the fewer heart attacks or strokes or other comorbidities, but I can't say much about the CBO. But we're not going to know that until we have more data and study these drugs and their impact over time. And as most of you know, a critical problem has been recruiting enough patients to participate in clinical trials. The percentage of United States patients that are participating in clinical trials can be measured in the single digits. Oracle's unique footprint in clinical trials allows us to connect providers to pharmaceutical research, because another big part of the problem is awareness and accessibility to clinical trials. Real-world data coming from the EHR, coupled with technology, can help achieve higher patient conversion rates, making it easier and faster to identify, discuss, and enroll eligible patients into trials. And so in the very near future, clinical trial opportunities can be put right into the EHR so doctors can empower patients to make more informed decisions about their care and participation into trials. And we're also forging ahead with an EHR to EDC clinical connector, because that automates the transfer of patient data from the EHR into electronic data capture systems for clinical trials. And this would eliminate the manual labor that occurs every day as data has to be re-entered from the EHR into clinical trial systems, or even worse, from paper. Thank you.